welcome to Dr. Tash TV. In this episode, I'm going to be answering a very important question. And that question comes from Tonya. Tonya writes, I'm 34 years young, pretty healthy, and my fiance and I are going to start trying for a bub next year. I've had my hormones tested and my progesterone was low. And it has come up after chaste tree supplementation. However, my morning temps could still be higher. I am iodine and vitamin D deficient, despite my diet containing more than enough iodine. I have an excess of sex hormone binding globulin and uric acid too. I have just recently, as of this week, started a dry month as I was drinking 4 to 5 glasses of wine 3 nights a week, which was my reduced effort to stop drinking every night, which would be about 1 to 2 glasses of wine with dinner. Do you think that my alcohol intake is affecting my hormone and iodine conversion disruption? And do you think my reduction in alcohol will help with becoming more fertile for the optimum condition to start trying? Thank you, Tonya, for this question. I love this question. Why? Because it's really common, it's complex, it's juicy, and look, let's try and break it down. So in addition to breaking down toxins, the liver breaks down hormones as well. It metabolizes hormones. And it's a really clever organ because when it gets intoxicated with toxins, literally, it has to prioritize and it thinks, okay, let's get rid of the toxins first. That's priority before hormones. When your body breaks down alcohol, your estradiol levels rise. Now, this is a fact. We know this. Science has proven this. And when your estradiol levels go up, what happens then is the brain thinks that there's enough estrogen running around, so it stops the signaling of a hormone called FSH. And FSH is a really important hormone in terms of causing normal follicular development and ovulation. So I'm not surprised that your progesterone levels have been low, because if you're having problems with ovulation, your progesterone levels will be low. The other thing about alcohol is it's a diuretic. So when you've had a big night out, you know that throughout the night you get up quite a few times to go to the toilet. Well, what happens when you're passing all that urine is you're actually getting rid of a lot of good nutrients as well. There have been many studies done on alcohol and its effects on the human body, particularly around ovulation, hormones, etc. And really, their conclusions are very mixed. When I get confused with any scientific conclusions, I try and go back to basics. I try and go back to basic biology. And in looking at hormone systems, this is a really good way to try and explain why things happen. The information we're given about alcohol can be quite confusing. You've probably heard that red wine is good for you because it contains polyphenols, which are a type of antioxidant. And whilst that's true, at the end of the day, alcohol is alcohol. And if you are trying to have a baby, you really shouldn't be having alcohol. Here's what the Australian Medical Association says about alcohol in pregnancy. I'm reading this directly from their position statement. Alcohol consumed during pregnancy crosses the placenta and can cause complications of pregnancy and damage to the developing fetus, including fetal alcohol syndrome. The risks are greatest with high, frequent alcohol consumption during the first trimester of pregnancy. As there is no scientific consensus on a threshold below which adverse effects on the fetus do not occur, the best advice for women who are pregnant is to not consume alcohol. In my view, the period that you're trying to actually have a baby should be considered a trimester within itself. I call it the 4th trimester, but in fact it comes first. During this time, your body really needs to be thinking it is pregnant, so that when you are pregnant, hey, giving up alcohol is not an issue. And how about the guys? Should they be having alcohol when they're trying to have a baby with their partner? I say don't. It's best not to, because we do know that sperm is actually affected by alcohol, and the more alcohol a guy has, the worse off his sperm will be. Tonya, thank you so much for submitting this question. I really enjoyed answering it. If any of you out there have any questions for me and Dr. Tash TV, please go to my website, click on Dr. Tash TV, submit your question, and please provide me with some more inspiration for Dr. Tash TV. Thank you for watching, and if you like this episode, please share it with your friends. Until next time, see you later.